In 2012, ChildFund Uganda, a non-government organization in Uganda, embarked on a pilot program to provide safe water and ensure sanitation by constructing water harvest facilities called water jars for vulnerable communities in Wakiso sub-county, Wakiso district. ChildFund's mission is to help deprived, excluded, and vulnerable children living in poverty have the capacity to become young adults, parents, and leaders who bring lasting and positive change to their communities. In partnership with community efforts for child empowerment, a local child-focused non-government organization implemented the project with support from ChildFund Ireland, aiming at attaining core outcome of ensuring healthy and secure infants. Established in Uganda in 1980, ChildFund Uganda embarked on the Water Jar project following a 2010 survey which estimated the population of Wakiso district at 1,310,100, making it the second most populated district in Uganda, grappling with access to safe water and sanitation challenges.
We had already worked out with the district on needs assessment, and we realized that there is still a big challenge in Wakiso, where we found that the vulnerable households could not even afford water bills. Water was not enough even in that district. And so we decided to write a proposal to see if we can be able to have this water problem solved.
Wakiso, Machindye, Wakiso Katabi, Kachiri, and Nende are among the 14 sub-counties which make up Wakiso district, including the 6 town councils of Chira, Wakiso, Kachiri, Masulita, and Entebbe division. In Wakiso sub-county, the program was implemented through community development interventions such as sponsorships, child protection, health, basic education, youth empowerment, micro-enterprise development, modern agriculture, early child care and development. Although Wakiso district water and sanitation recent data shows that the district has 72% of water coverage for rural areas and that 60% of the urban population access clean water from different water sources, accessing clean, safe water is still a major challenge among deprived communities.
So the challenge in Wakiso is quite high. You find only one jerrycan. For us, that's a 20-liter jerrycan. It's around between 500 to 800 shillings. And that's Ugandan shillings, which is quite expensive for a vulnerable household. An old woman who has about 5 to 30 vulnerable children. And we see that they don't even have the sustainable income. So we feel that that was very important for us to intervene.
In the sub-county of Wakiso, the available water sources are not sufficient to cater for the growing population. The communities still walk long distances to reach water sources, and the hygiene around these water sources is appalling, and waterborne diseases coupled with animal and environmental waste pollute water sources like the wells. The women, children, and the elderly are the most affected groups, with residents saying that some women have been battered for delaying at water sources, children dropping out of school, and farming made difficult.
Buying it every day, it is expensive. And where they've been drawing it from, there is a very big, a long line. At times you find people fighting for that water.
There was a problem of water shortage which was affecting the children in a number of ways. The children were affected in their schooling. Some children could not go to school in time because of having to go and fetch water.
They are walking long distances when going to fetch water.
They line up at the water sources and they come back home late. They cannot do their homework in time. And other things like domestic violence would erupt in the families in this community because of water.
The district intervention of sensitizing the communities on the sustainability of water sources has yielded low results. Communities argue that it is the responsibility of government to provide such services.
We put the structure in place, but some communities care very little for their operation and maintenance. So as an intervention strategy, we are continuing to mobilize and sensitize the community to care for their water sources.
Worse still, some community members wash their hands without soap after visiting toilet facilities. This has surged the spread of diarrhea and dysentery.
Though some have failed, others have tried to construct sanitation facilities like drying racks, pit latrine, rubbish pits, tip-tap, though some do not use soap to wash their hands.
ChildFund Uganda, in partnership with Community Effort for Child Empowerment, the communities and the Wakiso District Water and Sanitation Project constructed water jars for 40 households in Wakiso sub-county. The water jars cater for deprived families comprising persons living with HIV, orphans, and the elderly. The jars store water collected during the rainy seasons for the dry spell, provide the beneficiaries with clean and safe water, but also eliminates disease.
Our beneficiaries do not have to go looking for water. Our target was homes with a number of children below the age of 5 whom we realized that we are being given hard task of carrying water. One child can go to fetch water like a 5-liter jerrycan 3 times to fill up maybe a 20-liter jerrycan, and then that kind of tiredness has been overcome.
The water jars have proven to be economical, sustainable and long-lasting water storage facilities for the vulnerable communities because they were constructed with local materials and also provide employment for the youth.
They've done us a great job. We are thankful to that project.
Omukisa nti bwe twafuna amazzi nze mbeera wa waka sikya n'emmere kati njifumba n'endya kati nsena wali ku ttanka amazzi ntandika okufukirira obulimiro bwange era bulungi era bajjamu okujjamu ebintu.
Projekiti eno ndi musanyufu nnyo nayo olw'ensonga nti ekwatiddeko gavumenti okulabika nga ekulaakulanya abantu baffe.
It has helped us in cooking, not buying water. It has helped us in washing.
Ne kati kyeŋŋanyuddwa abaana bange bakomawo tebagenda mugga, basumulula ttanka yaabwe ne booza ne tufumba ne tukozesa byonna bye tuba twetaaze ku ttanka yange.
Amazzi ne bwe tuba nti oba sizoni ya kyeya amazzi tusobola okukima ne tusavingira omwo mu ttanka yaffe, then bwe lubanga ennaku za kusoma bajja buzinga basena.
Tulwanika busezezaayo esitunda gakola gankolera byange tegaggwemu ate ndaaga.
Amazzi bwe bulamu era emigaso gy'amazzi mingi nnyo ku bintu ebyetaagibwa awaka.
The project did not stop at water jar. It equipped communities with basic education on sanitation, the importance of covering a latrine, washing one's hands with the regular baths to eliminate diseases were some of the areas covered. The project also has a positive impact on community health, security, education and farming.
We came up with a criteria of who should get a water jar. So in that way, we put sanitation standards that people had to meet before they would get these water jars.
They have some components they base on. If you don't have a pit latrine, a drying rack, a rubbish pit, a tip-tap, during the assessment, they tell you that you improve, make sure that you put such facilities in place in order for you to benefit next time.
A 40-year-old widow, Hadija Namale, a resident of Kasenge village in Wakiso sub-county, says she uses the water from her water jar to make bricks, which she sells to raise money for school fees for her children.
Nainero obuzibu bwa bloke ezo nga zintawanya bo wange yawo kumpi naye wane kidomala abakyagala nusu 2 mwaga mu 5 naye kati wano wenjera nga nsumulako ku tanka yange nga nfuna ebidoma yange 5 oba 10 nga ngenda kutabula ttaka lyange nga nkuba bloke.
The project is also in line with the Millennium Development Goals of providing clean and safe water for all communities by 2015. However, only 40 households have jars and many more households remain without, yet the funding is ending in 2012.
We realized that they were not enough for the entire community, so we had to select those that were really in need, but then looking out for those people who really meet the sanitation standards. So we're looking at things like the state of the kitchen, the compound, how has that person managed to keep the compound clean? Does the person have a pit latrine, for example?
But all was not rose during the implementation phase. There were a number of challenges to get where it is to date.
The need is quite big compared to the resources that we have, but we managed to reach what we had targeted. Secondly, we find that the hygiene and sanitation knowledge is quite high, but when it comes to the real implementation, it's quite lacking. People's knowledge is high on hygiene and sanitation, but when you look at the behavior itself, it's the opposite.
But what are the future prospects of the water jar project?
Now, that is the basis that they have got water tank, but also improving hygiene and sanitation is beginning to increase. We want to continue making sure that we sensitize parents and even the neighborhood to improve on their hygiene. In some households, we have begun seeing people already who can be able to afford those tanks are already inviting the service providers to construct water tanks for themselves. So we want also to continue encouraging others to do the same. So much as the project is ending, we are planning to look for more funding to reach more vulnerable households that have not been able to achieve to get this benefit. We're also planning to work with the district. Where we've not reached, we feel that the district can also be able to help those families. And we are trying to advocate very much through the review meetings, through stakeholders meetings, to ensure that the district should speed up, be able to bring pipe to water in that area.
The pilot project has solved the water problems in the 40 households and has empowered the beneficiaries socially and economically. Thanks to ChildFund Ireland for the financial support.